ma'am. Good morning.
Good morning.
I am Cherry, your health practitioner for today, and I will be performing the assessment of the breast and the abdominal perineal area. Okay.
Okay.
So, before anything else, I would like to confirm your name and your birth date.
I am Gwendolyn Adobo, born in February 27, 1998.
Okay, thank you. So, Miss Gwen, do you have any particular complaints?
No.
Okay, so Miss Gwen, I'm going to begin the examination of your breast. We're gonna start with a visual inspection. So now, visually examine the patient seated at her arms at her sides. So we will just imagine that our patient is already take off his shirt. So in order for her privacy sake. So imagine that her breasts are exposed. So we have to note for the skin color, note for every abnormalities, or thickened skin with prominent pores. So observe for symmetry of shape and size. Some breasts have different in size, and usually it is normal. So Miss Gwen, can you please raise your arms straight up in the air? And then, Miss Gwen, you can perform the same motions where you can examine your breast at home also. So this is the first. This is the first of two arm movements that may bring out the skin dimpling or asymmetry. Now you can lower your arms and put your hands against of your hips. Okay. So with each movement, inspect the breast contour carefully. So look for dimpling of the skin and retraction of the nipples. So now, Miss Gwen, I'm going to have you lie down on the bed, okay? So now she's in lying position. So I'm going to place the pillow under your shoulder to distribute the breast tissue more evenly. So placing her hand on her forehead, but keeping her shoulder pressed against the bed. Okay. So begin palpation in the axilla. Make sure to palpate the tail of the breast. Progress in straight line down to the bra line, and then move the fingers medially. Using the finger pads of 3 fingers, pressing flat on the breast. Compress the breast tissue gently against the chest wall. Continue palpating in a smooth rotary motion. Palpate the entire breast using the systematic pattern, which using the parallel line. So to examine the medial portion of the breast, reposition the patient by placing the hand at her neck and lifting up her elbow until it is even with her shoulder. So continuing the vertical overlapping strips to the mid-sternum. Next is palpating the nipple, noting its elasticity. So continue palpating. So observe any discharges. Okay. Then when you're done on this side, shift the pillow to the other side and examine the other breast. So again, palpate. Change position. Now for the nipple. Observe any discharges. Okay. So back in a sitting position, we will now examine the axilla. So Miss Gwen, go ahead and raise up your right arm and hold it. So we should always note if there is any rash or infection or unusual pigmentation. So far there is none. Then now bring your arm back down and then support her right wrist with your right hand and ask her to relax her arm. Okay, arms, relax. So with your left hand, try to palpate the axilla. And then try to feel the central nodes against the rib cage. Note for their size, shape, and consistency, mobility, and tenderness. So for the pectoral nodes, feel the inside of the anterior axilla. Fold with your finger while your thumbs stabilize the tissue from in front. For the lateral nodes, feel high the axilla along the upper numerus. So everything feels good. Okay, thank you, Miss Gwen. And then we will do at the other side. Can you lift up your left? So again, note for any abnormalities, rash, or any infection. Okay, ma'am. Relax, Miss Gwen. So now we will proceed to the inspecting of her abdomen. So we must be cautious. We have to slightly expose her abdomen. So inspect the abdomen from all sides. Note for the size, shape, surface movements, and surface characteristics. So while in supine position, inspect the client's abdomen in all quadrants. So far everything is fine. Next is escalating the abdomen using our stethoscope. So we will listen for the vascular sounds using the bell. So note for the presence of bruise. So now we will percuss the abdomen. So we must note for areas of dullness or tympani. So percuss the area of tenderness. So we will percuss the spleen. Okay. So now we will perform the palpation. First is the light palpation. Next is the deep palpation. So now I will assess for kidney tenderness. So ma'am, I will examine your back. So Miss Gwen, there's no sign of any tenderness. So all are great. So thank you for cooperating and just relax. Okay. Thank you, Miss.
Thank you.